Welcome to the American Academy of Neurology. This is a webinar on advancing care information. I'm Dr. Melissa Yu, and I'm here with Dr. Alan Wu. As a brief introduction, I'm an assistant professor at Baylor College of Medicine in Houston. I have worked in the private practice environment as well as in academics, and I'm a member of the AAN Practice Management and Technology Subcommittee of the Medical Economics and Management Committee.
Hi, I'm Dr. Alan Wu, and I'm joining Dr. Yu in this AAN webinar. I am Associate Professor at UCLA and a Physician Informaticist within the EHR at UCLA, and I am also a member of the American Academy of Neurology Practice Management and Technology Subcommittee.
So what is ACI, or Advancing Care Information? ACI is an extension of the Meaningful Use program that we're all pretty familiar with. ACI emphasizes the use of the EHR to enhance 4 goals: patient engagement and access, coordination of care, health information exchange, and clinical registry reporting. There's more flexibility with ACI than was present in Meaningful Use, particularly in the 2017 reporting year. ACI is part of MIPS. In 2017, the various categories are weighed as follows. Quality is weighted at 60% of the total score. Cost is weighted at 0%. Advancing care information is weighted at 25% of your total score. Improvement activities are weighted at 15% of your total score. Who is excluded from participating in ACI? Hospital-based practitioners are excluded. Hospital-based is defined as greater than 75% of your Medicare charges come from an inpatient or ED setting. Non-patient-facing clinicians are excluded from ACI, as well as physician extenders such as nurse practitioners and physician assistants. If you're one of these excluded individuals, that 25% portion of ACI of MIPS will be assigned to the quality portion instead. So here's what you need to know about participating in ACI. 3 main ideas. Pick your path, fill your base, and get to 100 points. And we're going to talk about each one of those. So how is your total ACI score derived? As a reminder, ACI is 25% of your total MIPS score. 50 points come from your base score, which is a requirement that you submit these measures. 90 points comes from your performance score. You have 15 points that can come from bonus measures. As you can see, that adds up to more than 100 points. Your ACI score is capped at 100 points for full credit, so there is some leeway in how you participate. There are 2 main pathways for reporting, option 1 and option 2. Option 1 measures are very close, or what we know as meaningful use. You will choose your option mostly based on how your EHR was certified. Option 1 are the transitional objectives and measures. In this option, you are required to submit 4 base measures, 7 performance measures, and 2 bonus measures. Option 2 involves EHRs that are certified to the 2015 edition. There are 5 required base measures, 9 performance measures, and 2 bonus measures. To fill your base, you are required to submit all of these measures. You have to do a security risk analysis, and this is attested to in a yes or no statement. You have to e-prescribe at least 1 prescription. You have to provide patient electronic access to at least 1 patient, send a summary of care at least once, and if you're going down option 2 with the 2015 edition, you have to request or accept a summary of care. Note that the 3 measures in the red boxes are also used in the calculation of the performance score.
I'm going to continue with the ACI Performance Score categories, the second part of the ACI score, which can provide up to 90 points. What Dr. Yu just explained was the base score, which provides 50 points, and it is notable that that is a required score. If you do not finish the base score of 50 points, none of what I will talk about will score at all, and you will end up with ACI score of 0. So the base score is incredibly important. For the performance score, you can add further 90 points on top of the base score of 50. On the left, these are the 4 categories. The ones on the left are asterisks, which indicate that they overlap with the base score items. I'll go over that in the next slide. Here are the base score items that overlap with the performance score items. These 5 rows correspond to the exact same items that Dr. Yu discussed 2 slides ago. Only now you can see on the bottom 3 items, on the far left and on the far right, there are numbers which correspond to how much performance score you can also achieve. The base scores are scored based on whether you did at least one of each of those things. So for example, in line 3 here, provide patient electronic access. In order to score your base score, you only have to provide one patient electronic access, basically proving that you can use your EHR. Here, in performance scores, the score is asking what percentage of your patients are you providing that access to? And I will go over the calculation of that partial credit in the next slide. This slide shows in black the 6 additional items that do not overlap with the base score items. Taken together, this adds up to 7 or 9 performance score items, adding the 2 together. You will see that further on the next slide. Now, the partial credit you receive for each of these 10% ACI scores you see on the far left and far right column are partial credit. So for example, in row 3, secure electronic messaging, if you have 1,000 patients in your practice for your performance year, and 500 of them, 50%, can send a message to you, a secure message, then that's 50%, and you will score 5% of the 10% possible. In this way, you can get partial credit from your performance score items. And the items on this slide show 50 to 60 more ACI points available. This slide is busy, but it's identical to the previous 2 slides I showed, just put together. This shows in one place all of the base and performance scores we have discussed up till this point. In red on top are the base scores that are required to get your 50 points. And you can clearly see the overlap with the 7 to 9 items following down below, with the 20% 10 to 20% items on the left, 10% items on the right. Both columns add up to 90 possible performance score points or percent. Each item is partial credit scored. If you'll recall, the ACI score overall caps at 100 points. You already have a base of 50 points to qualify to get to this point, so you only need 50 out of the 90 points. You cannot do any better than that, so you can pick and choose the ones that you do well on. The third component of the ACI score is the bonus score, which can provide up to 15% or 15 ACI points. If you have already achieved 100 ACI points from your base and performance scores, bonus ACI points do not add further to that. On the other hand, if you qualify for any of these bonus score opportunities, that might reduce your dependence on some of the performance activities. The first type of bonus score is a use of certified EHR technology to complete improvement activities. This is an overlap with the improvement activities performance category of MIPS. If you are already doing an improvement activity, you can choose to do one that has an overlap with ACI, which I will show you. And you can receive 10% 10 ACI points. The second way to receive a bonus is by having your EHR report to a clinical data registry. Of note, the American Academy of Neurology Axon is an approved registry for this bonus. If you are participating or considering participating in Axon, this may be an incentive to do so. This slide shows a sample list of improvement activities that also will qualify for the 10 ACI bonus points. There are many, many improvement activities available for that category of MIPS. There are many of those categories that overlap with ACI. We have selected a few here that seems relevant for busy clinical neurology practices that would enhance care. And you can read them here. For example, the second one on the left is implementation of a specialist reports to close the referral loop. If you can get your EHR to do that, you would qualify for this bonus point. Another example is on the far right on top, implement practice process for regular individual care plans. So if you have your EHR participate in making sure your patients have this, this also would qualify for a bonus point. Again, you would get credit for each of these in the improvement activities part of MIPS as well. This slide shows the American Academy of Neurology ACI Calculator. Let me step back and just say that the ACI calculation is relatively complicated, and I do not expect that every practicing neurologist know all the details of every aspect of how the ACI score is calculated. However, the purpose of this webinar and this calculator is to be an educational one so that neurologists can become informed about what makes up the ACI score, see what affects it, and be able to have a more relevant conversation with your management and with vendors when you are discussing participation in ACI. So on the AAN website, which is linked here, you can have some basic information presented about this webinar, about how to choose your path. You can see on that second slide there's some information about the two options. And there is a calculation of base score, and there are additional sections for calculating performance score and bonus score. We are working on a version where you can compare option 1 and option 2, so this is an evolving tool. It is notable this tool does not report for you and is not authorized to do so. This is an educational tool to help you, your manager, and your vendor become more informed about ACI. So in summary, there are a number of key points here. First, ensure you meet all ACI base score measures. That is the number one thing to do. If you do not succeed in the base score, you will score 0, and there's nothing further you can do about that. The second is to check your EHR certification in order to aid you in choosing your option 1 or option 2 measure set. And there's a link here, and there in order to guide that. In most cases, you would simply ask your vendor. The third one is report on all your ACI performance score measures. There's no penalty for scoring poorly on any of them, and if you can get even partial credit on any of the 7 to 9 performance score measures, you will maximize your chances of getting to 100. If it's needed, or if you want to count it in, you can earn additional bonus points automatically. So if you choose a related improvement activity, you give yourself 10 points. If you are enrolled in the Axon registry, you get 5 points. And these are summarized also in an ACI Top 5 that we have also published on the AAN website. Thank you.